COVID-19 and the lockdown imposed across the country changed everything for Sri Lankans one and all. According to the latest available data, as of 2012, there are over 1,617,924 persons living with disabilities in Sri Lanka. For many, COVID-19 brought about a whole new set of challenges. With constant updates and misinformation on the rise, effective communication methods proved absent for persons with disabilities. Some mainstream TV channels carry sign language interpretations only during their main news bulletin and not during breaking news updates. This meant that hearing-impaired persons had no access to updates on curfew regulations and other important information. During curfew, many food trucks would drive along the streets with music to notify their presence, but hearing-impaired persons would have to rely on friendly neighbors to alert them.
My wife and I are both persons with disabilities. We faced many difficulties in order to make ends meet. As people living close to main town, we felt like this. I can only imagine the difficulties for those living in more rural settings.
Coming out of lockdown, a disability-inclusive response for COVID-19 was missing, especially among businesses and workplaces. Foot-operated hand-washing stations were difficult to use for persons with physical and visual disabilities, wheelchair and crutch users. Hearing-impaired persons relying on sign language and lip reading found it difficult to follow conversations with the use of face masks. Going about daily chores also proved difficult with physical distancing.
As people who require touch to navigate in public, it's been very difficult. Others must really put themselves in our shoes to understand how we feel.
Most persons with disabilities are daily wage workers, with only a handful being employed in the public or private sector. With the loss of income, the compensation package made available through the government of Sri Lanka was a relief. However, issues were also reported in accessing this fund.
We have worked hard to overcome obstacles in life to be independent. When we were left feeling helpless during this emergency, I felt mentally drained.
So how can we help? Access to timely information. We can create an effective network through CSOs that work with persons with disabilities on the ground to help with information sharing. We can also use inclusive communication material and innovative technology to ensure access to timely information during an emergency. Advocacy for a holistic disability inclusion emergency framework. We can design and implement more inclusive solutions, including guidelines for public spaces in Sri Lanka. Whether it be through innovative transparent masks or flickering lights to convey that a truck has arrived in the neighborhood, fingerprint signatures, and special hand washing stations, the options are endless if we all take some time to ensure that we leave no one behind.